Hello, my name is Samantha and I'm with Dallas Management Health Services. Today I'm going to demonstrate for you an OA offloader knee brace for the left knee. Okay, so what we're going to do first is we are going to unclip each strap. Okay, now I'm going to place it right here. This portion right here should be parallel to the kneecap, so it'll be positioned right there. And if you can hold that for me, please. Alright, so for the sake of time, I have already sized these two straps right here. In a moment, I'm going to show you this strap right here, how to size it, okay? Now, you'll tell the patient when putting these on, these are numbered 1, 2, 3, and 4. There's a certain order you need to put these straps on. This is labeled number 1, so when you put this on, you're going to put this strap on first. And the reason for that is because it acts as the anchor for the knee brace and it helps it stays in place much better. Okay, that one. This one second. You do this one second. Okay. Now there's a little trick to putting it in. You may have to push this belt down and angle it inward. Okay. Now this one here. See, it's too big. So I'm going to size it. And how are you going to size it? There is a little Velcro square on the back here. You're going to move either inward or outward to, now this was too big, so I'm pulling this the opposite direction. You just put the square here at the end of the strip, put it here, bring it back in. So it's kind of trial and error. It's still a little bit too big. So, and another thing I do is I'll bring it so this strap right here is closer to the end. That way when the patient putting it on, the Velcro strip will be right here and they're not reaching behind their leg to have to put it on. So since I did that, it made this strap really big. Okay, see, still too big. Now, see, this is the point where you may have some instances where you'll have to cut this strap, which I would have to do for this patient, but I'm not going to cut it right now. And when you do cut it piece by piece because you don't want to cut too much at first. Okay? So, sit over here. And still too big. See how it's kind of hanging off? It shouldn't hang off like that. Okay. I think that's got it. I think I got it. So once again, push it in, kind of angle it. And there we go. Okay, now this is the 4th strap. You'll put this on one next. And there you go. So I have the patient stand up. Go ahead and stand up for me, please, and kind of walk back and forth. See how that feels?
Feels
okay,
great.
Did it feel a little loose when you stand up? When you stood up?
No, it feels okay.
Okay, so go ahead and have a seat. Now, what I do next is the part where I will adjust it medially or laterally, depending on the patient, what kind of relief they need. I will turn it counterclockwise for medial relief, and then I would either turn it clockwise for lateral relief. So you put this Allen wrench tool, this is the one you'll use, you'll put it here, and you're going to turn it counterclockwise for medial relief, or you will turn it clockwise for lateral relief. And you can actually see the brace move as I did that. So as I adjust it, I'll have the patient stand up and walk for me again. Go ahead and stand up and walk there. Okay, did you notice a difference?
Yes.
Yes? Okay, so the patient may or may not sometimes. You just have to keep on wearing it and then you may be able to tell the difference then.
Okay.
And that is your offloader knee brace. Thank you.